Welcome to Boston Community Health. I'm Dr. Elias Thor. In over half of all stroke cases, the human brain sends 7 crystal clear warning signs within 24 hours before the catastrophic event hits. But most people ignore them until it is too late. These are not vague physical feelings you have to guess at. They're actual, clearly identifiable biological signals. The absolute tragedy is that most individuals notice a sign, but feel relieved when it disappears on its own within minutes, and they do absolutely nothing. That false moment of relief might genuinely become the most dangerous moment of your entire life. Today, I will walk you through exactly what this hidden 24-hour window looks and feels like, including the red flags your physician has never sat down to explain to you in plain English. A stroke is not an unpredictable medical event that simply happens without a reason. In the vast majority of clinical cases, your body is actively waving a red flag before the catastrophe arrives. By the end of this video, you will know exactly what to watch for, what is physically happening inside your vascular system, and how to act urgently in the critical hours that follow. Remember, a stroke is not like a light switch suddenly flipping off. Your arteries are living vessels, damaged and progressively narrowed over years by plaque accumulation. Once a major artery feeding the brain is significantly narrowed, it becomes unstable. Tiny fragments of cholesterol plaque or small blood clots form, temporarily reducing blood flow, triggering what medicine calls a transient ischemic attack or tear. Transient means temporary, the clot shifts, blood flow resumes, and the physical symptom vanishes. This disappearing act falsely convinces seniors they are safe, but a TIA is your body screaming that a major stroke is imminent within 24 hours. Before we uncover the 7 signs, take a second to click like, subscribe to Boston Community Health, and comment your age below. Warning sign number 1 is the face that does not match. You stand at the bathroom mirror, try to smile, and notice one side feels slightly droopy. You feel a slight numbness, or when trying to drink, fluid unexpectedly dribbles from one corner of your mouth. What is happening inside your brain is that the motor control strip, the region sending movement commands to facial muscles, is receiving severely reduced blood flow on one side. Because each hemisphere of your brain controls the opposite side of your face, a disruption in the left hemisphere instantly causes drooping on the right side. Since this is a TIA, symptoms might fade within 10 minutes. Most individuals are half asleep or rushing, causing them to miss this subtle signal. I need you to memorize a simple 3-step face check right now. Smile widely, raise both eyebrows, and speak a sentence out loud. If one side moves less, one brow does not lift evenly, or your speech sounds slightly slurred, that represents a neurological emergency requiring same-day medical attention. Warning sign number 2 involves the arm becoming suddenly weak. We must separate ordinary weakness caused by sleeping wrong from a central neurological issue. When an arm is mechanically compressed, it tingles and normalizes rapidly with movement. A pre-stroke warning sign looks entirely different and far more concerning. You are sitting relaxed in your chair, not compressing the arm, but suddenly one arm feels heavy, weak, and difficult to lift. This happens only on one single side of your body. What is occurring inside the brain is that the specific motor cortex governing arm commands is losing its blood supply. The nerve signals are getting interrupted. It is exactly like a phone call breaking up because the transmission tower has a malfunction, not because your phone is broken. One-sided arm weakness during rest is a severe red flag that should never be written off, even if it resolves within minutes. Warning sign number 3 is the word that suddenly disappeared from your mind. This is not a normal tip of the tongue senior moment where the word pops back later. You open your mouth, but the wrong word comes out, or words are completely scrambled despite your awareness. Sometimes, when a family member speaks, it sounds like meaningless noise and you cannot process the definition. If you find this valuable, please click like and subscribe right now. Inside the brain, Broca's area produces speech and Wernicke's area decodes language. Both sit in the left hemisphere and rely on the middle cerebral artery. When blood flow to these language sectors is interrupted, your ability to communicate breaks down instantly. Never rationalize this event as mere tiredness. A sudden, unexplained disruption in speech lasting only 2 minutes is one of the most specific stroke warning signs recognized. Warning sign number 4 is vision that suddenly goes dark or double. There are 2 distinct vision-related warning signs pointing to completely different vessel territories, and they constantly get dismissed as simple eye strain. A first vision sign is one single eye going dark, feeling exactly like someone turned down a dimmer switch on just that eye. This typically lasts under 60 seconds and then clears completely. This happens when a tiny clot or plaque fragment from the carotid artery in your neck travels upward and briefly blocks the small artery feeding the retina. Your retina is effectively a direct extension of your brain, and its serving artery branches off the same vascular system. The second vision sign is sudden double vision, or simultaneous loss of half your visual field in both eyes. This type of vision problem points directly toward the back of the brain, the occipital lobe, losing its blood supply. Both of these sudden vision symptoms, especially when disappearing after a few minutes, deserve an urgent emergency evaluation, not an eye appointment next week. Warning sign number 5 is balance breaking without any obvious reason. You're walking through a familiar room and suddenly your foot lands wrongly, causing you to veer and reach out for the wall. Or a sudden wave of intense vertigo hits while sitting completely still. The brain region governing coordination is called the cerebellum. The cerebellum sits at the base of your skull, constantly receiving signals from your eyes and inner ear to keep your body upright. It is fed by a completely separate system called the vertebral arteries running through neck bones. When blood flow through these vertebral arteries drops suddenly, the cerebellum essentially loses its input signal, causing abrupt unsteadiness. Vertigo in seniors has many common causes like medication side effects or dehydration, but you separate TIA-related balance issues by one clinical rule. Severe vertigo usually comes with company, appearing alongside slurred speech, vision changes, or numbness. Seeing symptoms from 2 or more categories simultaneously represents a neurological emergency requiring immediate diagnostic imaging. We move to warning sign number 6, a sudden, severe headache with no identifiable cause. Older adults frequently manage ordinary headaches due to weather changes, sinus pressure, or neck strain, causing them to dismiss this flight. But a pre-stroke headache is entirely different. Clinicians refer to this as a thunderclap headache. It does not build up slowly over hours, but reaches its maximum agonizing intensity within the very first 60 seconds of onset. This thunderclap headache results from a sudden spasm of a major cerebral artery or a sharp blood pressure spike straining a weakened vessel wall. If you find this video helpful for your family, please take a moment to click like, subscribe to Boston Community Health, to leave a comment below sharing your blood pressure routine. Your interaction actively helps the algorithm spread this life-saving video to protect more seniors. This intense pain usually concentrates at the base of the skull or behind the eyes, signaling severely disrupted blood flow. Warning sign number 7 is transient one-sided numbness during rest. This sensory numbness does not affect both sides but attacks exactly one half of your body, encompassing one arm, one leg, and the facial features on that same side. You are sitting reading and suddenly notice a pins and needles feeling, a complete loss of sensation like a dental anesthetic injection. What is occurring inside your brain is that the parietal lobe, the region responsible for processing bodily sensations, is losing oxygen due to a temporary clot blocking its serving vessel. Since this represents a TIA, blood flow clears on its own within minutes, and your full sensation returns. The defining characteristic of all 7 warning signs within this 24-hour window is their temporary nature and rapid self-resolution. This self-resolution represents an incredibly dangerous psychological trap. Seniors often fear burdening their children or dread emergency room visits. Therefore, when symptoms fade, they immediately feel relieved, rationalize the event, and choose silence. Do not fall into that trap. Statistical research demonstrates that after age 55, the rate of blood vessel wall damage from chronic risk factors like hypertension accelerates dramatically. High blood pressure your vessels could easily withstand at age 45, causes significantly more wall stress and plaque instability at age 65. There are 2 chronic biological processes you must understand. The first is called endothelial dysfunction. That inner lining of your arteries, the smooth non-stick surface we discussed earlier, progressively loses its natural ability to expand and contract with age. The vessels become rigid and scarred, creating the perfect environment for blood clots to develop. The second biological process is the natural nocturnal blood pressure drop during sleep. Normally, blood pressure drops by 10 to 20% to allow body recovery, represents a highly healthy physiological pattern. But for an older adult possessing a significantly narrowed artery due to chronic plaque, this nighttime blood pressure drop can reduce flow through the narrowed segment to near zero. This dangerous mechanism explains why many seniors go to bed fine, but wake up with severe stroke symptoms. Understanding this medical reality proves that evening or overnight morning symptoms must never be dismissed as just being groggy or sleeping in a strange position. To transform this knowledge into immediate self-advocacy, if you have experienced any of these 7 warning signs, initiate 3 strategic conversations with your physician. First, ask about a duplex carotid ultrasound. This is a non-invasive imaging test utilizing safe sound waves to evaluate the 2 large blood vessels in your neck supplying your brain. Unlike a standard ultrasound, a duplex scan provides both physical and anatomical structure and real-time blood flow velocity data. If the ultrasound shows plaque has narrowed your carotid artery beyond a 70% threshold, that condition is classified as hemodynamically significant. This means blood flow to your brain is seriously impaired, and the risk of clot formation traveling upward is extremely high. Knowing this number provides a precise clinical roadmap for what needs to happen next before complete blockage occurs. Your second strategic request is a hemoglobin A1C blood test. A hemoglobin A1C test is completely different from a standard fasting blood sugar check done in the morning. This metric reflects your average blood glucose control over the past 3 consecutive months. You cannot fake a good result with 1 clean day of fasting before the blood draw, because it measures sugar permanently attached to your red blood cells over their lifespan. This test accurately catches prediabetes, the dangerous zone where blood sugar is elevated enough to quietly erode your arterial lining, but not high enough to trigger obvious clinical symptoms. In adults over 55, prediabetes often goes undiagnosed for years, silently setting the stage for a vascular catastrophe. Your third strategic request is a 24-hour Holter monitor cardiac rhythm evaluation. There is a highly dangerous and common heart rhythm malfunction in older adults called atrial fibrillation. Atrial fibrillation causes the upper chambers of your heart to quiver chaotically instead of beating in an organized rhythm. When the heart quivers, blood is not ejected efficiently, but swirls and pools inside the cardiac chambers. Within that swirling, stagnant blood, large clots easily form. When these large clots eject from the heart, their direct destination is a brain artery, causing a cardioembolic stroke that tends to be clinically severe and physically devastating. The tragedy is that many older adults experience paroxysmal atrial fibrillation, meaning it occurs for only a few minutes per day and self-resolves. A standard 10-second office ECG almost never captures these hidden episodes. A continuous 24-hour Holter monitor successfully catches these brief anomalies. Once accurately identified, specific anticoagulant medications can be prescribed which reduce your cardiac-related stroke risk by 60 to 70%, completely protecting your brain cells. These 3 targeted evaluations provide a comprehensive clinical picture of the top underlying drivers of stroke in adults over 55. Now, let us focus on your immediate response protocol at home and the common well-intentioned mistakes that can drastically worsen brain tissue survival. The first and most dangerous mistake: you must absolutely never drive yourself to the emergency room while experiencing sudden neurological symptoms. Even if your symptoms appear mild or are beginning to resolve on their own, your physical coordination and reaction time are already heavily impaired without your conscious awareness. A few brief seconds of vision loss or dropping arm control while driving at highway speed will instantly become life-threatening for yourself and everyone around you on the road. Call emergency medical services immediately, or have a family member drive you without delay. Establish a concrete response plan with your household today. The second catastrophic mistake is taking blood-thinning medications like aspirin on your own initiative at home. This represents a highly common instinct because people know aspirin saves lives during acute heart attacks. But you must understand clearly a stroke is not biologically the same as a heart attack. Medicine classifies strokes into 2 major categories with completely opposite mechanisms: ischemic stroke caused by a blocked vessel and hemorrhagic stroke caused by a bleeding vessel inside your brain. Blood thinners like aspirin help during a blockage, but will cause a catastrophic, fatal outcome by accelerating bleeding during a vessel rupture. The only way to differentiate them is an emergency brain CT scan. Therefore, let the medical team make the critical medication call only after structural imaging is complete. While waiting for professional help to arrive, what you must do is focus entirely on proper body positioning. Have the person lie down comfortably with the upper body elevated 15 degrees using a thin pillow, keeping the neck in a neutral position, not sharply tilted forward or thrown back. This position maintains optimal oxygen flow without straining intracranial pressure. Mistake number 3 is exposing the individual to excessive heat, including taking a heat bath. or drinking either hot fluids under the false impression that warmth improves vascular circulation. This sudden heat exposure triggers widespread peripheral vasodilation, causing systemic blood pressure to drop sharply within an already unstable circulatory system. This pressure drop immediately reduces vital blood flow to the ischemic brain tissue, expanding the permanent damage zone rapidly. Additionally, ensure you have a written daily medication list prepared for the first responders. Having this paper ready saves precious golden minutes, directly influencing the acute treatment decisions. Let us bring all of today's vital medical insights together into a powerful protective shield. A stroke remains a leading driver of death and long-term disability worldwide, but the vast majority of catastrophic events are entirely preventable if we act correctly during the 24-hour window. You now fully recognize the 7 distinct red flags: one-sided facial drooping, sudden arm weakness at rest, jumbled or missing speech words, temporary vision changes, abrupt loss of balance, a thunderclap headache, and transient one-sided numbness. Memorize the most critical clinical rule in neurology: when 2 or more of these distinct warning signs appear together simultaneously within the same window, your risk multiplies exponentially. The pairing of symptoms like arm weakness with slurred speech or vertigo with brief vision dark proves a specific major blood vessel territory is under extreme circulatory stress. The 72-hour window following these temporary warning episodes represents the period where effective stroke prevention medicine happens. When arriving early, doctors perform advanced imaging to locate unstable plaque and measure narrowing, allowing them to intervene before the arterial blockage becomes complete. This represents the golden window that many individuals unfortunately waste due to a false sense of security. I want to leave you with a vital mindset shift. The stroke you successfully prevent does not make dramatic breaking news. It carries no intense resuscitation moments inside an emergency operating room. It remains completely quiet. The beautiful outcome of that wise prevention is just an ordinary morning, where your brain stays sharp, your steps remain steady, and you continue having warm conversations with family. Mainstream medicine and clinical research exist entirely to protect the quiet, priceless, ordinary outcome for your life. Write down these 7 warning signs on a paper note or store them inside your phone app. Share this educational video link with the people you care about most: a spouse living alongside you, an aging parent, or a sibling over age 55. The individuals who are at the highest statistical risk of facing this vascular storm will likely never search for these clinical studies online. Your small act of digital sharing today might become the exact reason someone's vascular system is saved from a devastating future paralysis event. Your self-advocacy allows them to preserve their cognitive mind to live an independent, happy life. If any single symptom from today's video matches an experience you have already passed through, do not let another week slip by in silence. Initiate a firm conversation with your physician. I'm Dr. Elias Thor from the trusted medical organization Boston Community Health. Our professional mission is to deliver honest, international geriatric knowledge without fear-mongering to help you dominate your health destiny. Your brain is a completely priceless and unique asset, deserving your highest level of wise protection daily. Always stay sharp, stay highly informed, and master your own destiny. Please click like and subscribe to Boston Community Health right now, and leave a comment below about the warning sign that surprised you most. Wishing you continuous health, longevity, and see you next time.